Hello, everyone. Hello, hello. Thank you and welcome to today's live webinar, Smarter Systems, Better Care. We are so glad to have you all here with us. And whether you're tuning in between patients or joining from your home office, thank you for spending part of your day with us. My name is Malika Hofstad-Retner. I am going to be your host today. We've got an insightful session ahead that's especially helpful if you are building or scaling a modern mental health practice. Now, let's get into it. I'm very excited to introduce today's speaker, Dr. Brook Choulet, also known as the performance psychiatrist. If you've seen any of our webinars last year, you saw Dr. Choulet, and so she is back with us today. We're very happy to have her. She's a powerhouse in her field, and she's the founder and CEO of Choulet Performance Psychiatry. She's the president of the Maricopa County Medical Society Foundation and one of the 7 founding members of the American Board of Sports and Performance Psychiatry. She works with high-performing executives, elite athletes, professionals. She's also a contracted psychiatrist for over 650 student athletes at Arizona State University. Her work has supported organizations like the NBA, WNBA, MLBPA, USOPC, and so many more. But today, she's here to share something a little different. We're very lucky that she's able to give us a behind the scenes look at how she's used smart systems and automation to grow her group practice while keeping overhead low and patient experience high. So she's going to walk us through how she uses PracticeQ to simplify her operations from scheduling and billing to communication and documentation, and how those same systems can help you scale your own practice more efficiently. Dr. Choulet, welcome. We are thrilled to have you. And I'm going to kick it over to you now.
Thank you, Malika, for the wonderful introduction. I'm going to touch more just on the clinic itself. So I'm a board certified psychiatrist. I own a group practice in Scottsdale called Choulet Performance Psychiatry, where we have 4 psychiatrists, 4 psychologists, and 1 admin employee. And then also, hi Chelsea, it's good to see you. I'm also the founder of Beverly Hills Concierge Psychiatry, which is a California practice where we have 2 psychiatrists. So I really just want to say this to emphasize that no matter how many clinics you're running or people with the PracticeQ systems, you can really optimize and automate things so that you really only need 1 administrative employee if you're cash paid, depending on the amount of clinicians that you have and the amount of volume you have. So my goal today is to tell you that, to show you that you could do a lot of this yourself and automate things through PracticeQ software rather than hiring a bunch of different people. That's going to cost you more and make your take home less to do the same job. I also do private practice consulting, and like I mentioned here, because there's these 2 separate entities, one in California, one in Arizona, we have 2 different PracticeQs set up and all set up the same way. So it is possible to run in multiple states, even if you have a different tax ID, a separate entity, all of that. So we'll dive into that a little bit too. So this is our team, our fabulous team. Love these people, but just wanted to show you how many people we have on PracticeQ. So there's 8 of us clinicians and then 1 administrative employee. And then all of our forms, scheduling, billing, portal messaging, everything you name it is through PracticeQ. And then the clinic software we use, because I get this question often, is people are using so many different types of softwares or companies to do things that could be boiled down into just a few. So for us, we have PracticeQ. We use Google Business for G Suite, like Gmail, Google Drive. This is also, because this question comes up a lot, this is also where we track all the incoming calls is through Google in an Excel spreadsheet. So I'm a big believer that patients shouldn't hit PracticeQ or hit the EMR until they're actually scheduled patients of the clinic, and I'll go through that a bit too in the live demo. So that's a good way to track without putting patient data in PracticeQ that aren't active patients yet. And then the third software we use is RingCentral, which is for phone and our office messaging, text, and fax. I will preface that with saying automated text go through PracticeQ, which we'll go through, but any kind of like asynchronous patient to provider text go through RingCentral. So we're going to go through these in the live demo, but this is just that you have this in one screen for later. But what I think is really important, and what I joke all the time that people cheap out when they're doing private practice cash pay businesses, is a lack of really nice branding. You really want patients to be able to walk away feeling like they know you, know the brand. And what I like about Practice Q is you can infuse your brand throughout, so it looks really custom to you. What I did is put up a slide here that shows where the different areas are for branding that you should be customizing. So one is going into more settings, form header, which we'll do in the live demo, same with email sender, and then also customizing your widget, which if you don't know what the widget is, that is the area where you're able to kind of create a mini website where people can go and book kind of like a call or a service, and we'll go through that as well. The other thing that you can customize branding wise is your invoice settings. So anytime people get a receipt from your clinic or a super bill, you're able to customize that so it has the look and feel of your brand. Same with portal messaging. So you'll go to the portal messaging icon at the top, hit settings, click on style, and you can actually put in the hex code of your business's branding colors. The last area, which I put a screenshot of, is forms, questionnaires. Click on the three dots, click on settings, and click custom header. This comes in when you have multiple providers at your practice. So for example, like in the main settings, which we'll go through, that form header applies to everything in Practice Q. But if you have multiple providers in your practice, and let's say I'm sending out an intake form for Dr. Choulet, then I will create a custom header, which looks like what's on the screenshot here for just my intake forms. And that way, like if Dr. Gallardo or Dr. Bowen sees someone, they have their own, and so mine are customized to me. So there is like that extra layer of customization. The other one-time setup must-have, so some people will hire me to go into their Practice Q and set it up all at once. So this is a little cheat sheet I created for you, where again, you'll get a recording of this after and can pause on the screen. But these are all the areas where you'll want to go through and really make sure that you've customized to your clinic. So I'll do this in the live demo as well, but I also wanted to just create a list because I'm a list person of the areas where you should be going and customizing things. The good news is that there's so many areas of customization, but that's also the bad news, right? Is that if you miss one, you'll probably find out about it a few months in when a patient says, well, your name said this in one area, but I got this reminder that said something different. So we'll go through that as well. Customized messages. So because in the live demo, it's not my Practice Q, I wanted to paste in a few screenshots of what our clinic looks like. So if you go to booking settings, and then click on messages at the top, you'll see that you're able to create some customized email templates as well as SMS templates. The SMS templates, again, these are the automated messages that are being sent to your patients for certain service types. So for example, if a patient has a telehealth visit, there's no reason they need parking instructions. So if you were to click edit, you would see that these parking instructions, SMS templates, are only set for office visits. I really like this because, like you see, every single provider has a different template because I put their actual direct phone number. So if a patient is struggling to find our office, they can just shoot that provider. So this is a really good example of minimizing administrative burden. You do not need an employee to answer the phone just to ask where the office is if you can set up an automated parking instructions text message. So really cutting down on the number of incoming calls is important in order to alleviate the need for additional administrative staff. Same with email templates. I always joke with people, like if you are still manually sending and attaching intake forms and then uploading them manually to your EMR, you are way behind the times. And the good news is Practice Q will solve this problem for you. Our email templates are customized because Practice Q allows you to customize basically every single type of email that your patients get. So as soon as even you click on, you can see here the intake email confirmation where a patient's getting a confirmation of their first visit. That patient is getting a custom email that you'll see on the next slide, as well as a custom reminder. And then the biggest thing the clinic utilizes, which cuts down on so many calls administrative burden is the Zoom appointment link. So we have Zoom integrated with all of our telehealth visits so that our patients automatically get an email 1 hour before the appointment time with their Zoom link. And we'll go through in the live demo how to do this as well.
We do have a question if you wanted to answer it right now. The question is asking, why don't you have clinician-specific email messages like your text?
So with the email template, I'll get to that on the next slide, but there's brackets basically in intake queue customizable templates where you can say like bracket practitioner name, so it'll auto-populate whichever clinician is assigned to that. Another person I saw asked, would you mind, do you run the 2 practices under 1 account in practice queue? No, the reason is because the practices have different EINs, different tax IDs, they're different entities, so different billing, different bank account. So for that reason, they have to be separate. And then someone else had asked, why do you use Zoom instead of the practice queue internal video platform? For us, I have so many other meetings on Zoom that are external to the clinic. So I would just like everything on one platform, and I have the Zoom HIPAA compliant version. So for me, I prefer Zoom because all of my meetings are on my Zoom calendar rather than, again, like I don't want one like software just for patient telehealth and then another software for my external meetings. So for me, I'm all about simplicity. So this is actually our Zoom meeting reminder email template. So I put in the top left how you can actually click through to this. So booking settings, click on messages, add email, and then you'll see an option, create a Zoom meeting reminder email template. Don't forget to click the checkbox that when you want it active, otherwise you will have created this great template, but it won't be active. Above this, what you're not seeing just because it's cut off is you can actually go through and select all the service types that this should be attached to. So again, you shouldn't be sending this for an office visit. So just that you could control find telehealth and then just select all your telehealth visits. And we send it 60 minutes before the appointment. So if I send it too far ahead of the appointment, it might get lost in their email. So we just send it 60 minutes before. And then like you see here, you'll get the bracketed Zoom meeting invitation. The system will automatically create a Zoom link for this, and it'll populate in your Zoom calendar, your intake queue calendar, everywhere. And you haven't done any administrative work to send this Zoom link to your patient. So this is one of my favorite features in practice queue, but we use this all the time for telehealth visits. The next one is the customizing the provider appointment confirmation email. So like someone had asked, why doesn't each provider have one? That's because it says in here that your appointment with bracket practitioner name has been confirmed. It reminds them of some of our policies. It reminds them that if they don't complete the intake paperwork 48 hours before the appointment, we will cancel the visit. And again, this is all customizable. So you can put in whatever message you would like, policies you would like. It's very easy to use. So same with the SMS we talked about. This is a screenshot of what our parking instructions say. So again, each person has their own because I've customized the cell phone number that's in each SMS template so that if our front desk person is out for the day or if she's at lunch, it's not just getting a text message sent to her and potentially she's unavailable. So again, cutting down on the burden of administrative time and need by using some of these automated systems. The last one I wanted to highlight that is probably my favorite, so even above Zoom, my favorite feature of Practice Queue is the auto payments. So just to note, the Square account is no longer available. I was grandfathered into this because I joined Practice Queue so long ago, but this is replaced by Practice Queue payments. But essentially what I want to highlight is right here that when the card is on file, which it should always be on file, charging the client on the day of the appointment, and we do 1 hour before the appointment time so that if someone's coming into the office and their card's been declined, we know ahead of time to capture a new card when they arrive at the clinic. And then when a card is not on file, invoice is automatically sent to the client. And then when an auto charge fails, an invoice is automatically sent to the client. So again, super important because that cuts down on a billing person. So let's say that you have a cash pay practice where you're not taking any insurance. This like totally takes up the job of what a billing person would do, which is manually running the card, manually sending out invoices if a card is declined. Like the system is already doing that for you. So I can go through my clinic day seeing people back to back and then never worrying about if appointments are being run. And when we go through the notification section, you can actually set up getting an email yourself. So if you're solo and don't have any administrative help, you will get an email saying payment's been run successfully or card's been declined. The last thing I wanted to highlight is processes. So this is something that is highly specific to each clinic. I just put a screenshot of what we do in our clinic. But for new patient onboarding, we've set up this automated process that you can see here is assigned to our front desk staff. So you can assign each task to a different person, whether it's the provider seeing the patient, front desk, whoever you would like. You can set up basically your patient onboarding process. So as you can see here, this is just what we do is 3 days before the task source date, which is the appointment, send a reminder text to complete intake forms per our 48-hour policy. So our front desk girl would get a notification in the task at the top that morning saying, hey, send a text to so-and-so that they haven't completed their intake form. Then you can see 2 days ahead of the source date, which is the appointment, make sure the intake form's complete. Then 1 day before, we basically have a non-secure electronic form of communication where patients can consent to receiving text messages, emails that are unsecure, FaceTime, whatever it might be. Then our administrative employee will go in and actually manually add that to their patient profile. And then the last thing is 1 day after the appointment, it will flag her to send them an invitation to the messaging portal. And then we have an automated message now where it will send our new patient packet through that portal messaging system. So this is the other big one, that when a credit card on file is declined, then it will flag our front desk to send them a new credit card authorization form. And you can see that's in the task tab. And then on the automation tab, it says trigger this process when the appointment auto charge fails. So these are just 2 really small examples of how you can use the processes feature, because again, on the live demo, it's not set up to our practice queue. These are the only 2 I use. I'm sure that you could get a lot more creative and do a ton of different processes, but these are the ones that stand out the most to us. So feel free to use these and create your own. And that is it for the slide section. I'll let you scan this for a second, and then I will jump in to the live demo. So Malika, any questions to catch me up on while people scan this?
So we do have quite a few. We have one question that asks, is there a way to insert the clinician's phone number and email as a field?
I don't think so. I don't think that that's one of the bracket options. I'm sure someone smarter from Practice Q could answer that, but I don't think that that's an option. What you would do then is just create different emails, different custom emails, and then assign it to specific clinicians. So that's the way that you would manage that. So same way, like you saw, I created all the different clinician parking instructions, you would create a different clinician, like customized appointment reminder email and an appointment confirmation email.
And Sylvie, just to let you know, we'll also make sure that someone from Practice Q follows back up with you to see if there may be a way to do it. I do have another question, if you don't mind, Dr. Choulet. Someone said you mentioned it may be a good idea not to enter PT into Practice Q until there's, I think you're saying an appointment. I offer free 15-minute intro calls and have an appointment widget on my website to book these. Therefore, their demographic and insurance info for eligibility verification goes to Practice Q. Do you have any recommendations?
Yes, so the complicated answer to that is the way we monitor the call log is that when a patient calls, they'll be entered into the Excel spreadsheet call log on the secure Google Drive. if that person schedules, so if that person is looking for insurance only or doesn't schedule, says they'll call back, nothing gets entered into practice queue. If that patient wants to schedule a 10-minute call with the psychiatrist or psychologist, our front desk will enter them for a 10-minute complimentary call, just like you do the free calls, into practice queue. However, our process in our clinic is if they do not schedule an appointment, we immediately archive that patient chart. That way we can have a record that they've called in the past, or, you know, like whatever it might be, but that way it's not an active patient, and it's not sitting in that practice queue active list, but it's being archived and it's no longer kind of a part of us.
And I do just have one more question. Someone came in with it. They were saying you were saying you don't use the SMS messages within practice queue, but that I think you were saying you use it in Ring Central. They just wanted to know what else you use on that beginning slide that you had.
Yeah, I just use Ring Central for the inter-office messaging, asynchronous patient texting, fax, phone tree, like all of that good stuff is all in Ring Central. And then, like you saw in my screenshot, the only text we use through practice queue are the appointment reminders and the parking instructions. Okay, so starting with the branding, we talked about customizing practice queue so it looks and feels like your brand rather than practice queue. So the first step, again, this is if I were coming in, setting up your practice queue for you, I would go to More, Settings, Form Header, and then you'll see this wonderful button called Header Helper, which I love because I don't want to do it myself down here. And you will click in here and you'll put in all your information. You'll see here, even if you put in a fax. And then what I like here is, again, you can customize this to your own brand. So again, these are the practice queue colors, but you can actually click and put in your own branding colors for each of these things. So then you're, like, let's go ahead and go to a logo, for example. And you can upload that here. So then your logo will be there. You could change the logo size. You could do anything like that. You can then match the colors, the links. So it's very customizable. Then the next step, I would go to email sender. So you can actually say like, okay, I want people to get emails from practice queue, and the sender email address is going to be marketing@practicequeue.com. And then hit save, and then you'll see this load, and it says it's a public provider, but as long as yours is a paid one, you will be able to customize the display name and the sender email address. So same with, then you'll go to bookings. Oh, while I'm in there, I'll come back to that. But bookings, then booking settings, and the widget is the next customizable portion. So you can create your own like practice queue website that will take you to what practice queue is created for you based on your own branding. So you can see it doesn't have a header image here. There's no brand coloring. So the way that you fix that is you go to customize the look and feel of your mini booking website. And then that'll allow you to create like your custom branding, let's say practice queue. You can change the branding color in the background. You can preview what your header is gonna look like. Or if you're like me, you can just click add image and you can upload your logo directly into there. The next one to customize is going to be going to lists, invoices, and then invoice settings. And then here again, so there's so many places to customize, so you want to make sure you're getting into all these nooks and crannies. The best thing to do here, again, put in your business name again, put in your address, put in all this stuff over again, upload your logo so that this will be on all of your invoices. You can also customize if you want any additional text. So you could say, thank you for choosing practice queue, and that would be at the bottom of every single one of your invoices. You can add an image there. You can include payment details. So this is a really nice way to customize what your invoices will look like. Another thing too is the super bill. So this is, again, all one-time setups. You would go in, put in your group NPI number, tax ID. This is where you can also manage CPT codes. And then you want to enable super bill storage if you send super bills to your patients, and then save changes. There's different customizations in here too, so you could choose how you want patients to receive their invoices. As a psychiatrist, I remove allowing tips because that would be unethical. So again, you want to just do all these things as a one-time setup, and there's lots of different customizations in here. You can also customize your email. So I will say this is something we do where we will actually put in like, please find your super bill attached. You may utilize reimbursify.com to attempt to get out-of-network reimbursement. However, we do not guarantee this. So again, you could customize what people are receiving when they receive the super bill, the receipt, the invoice, whatever it might be. And then now they've added a good big estimate tab as well. You can also have like the option if you want people to be able to access invoices with a secret link or with an access code to make it extra safe. The next step for customization will be clicking on this portal messaging, the secure messaging at the top. And then this, if you haven't noticed already, is your client sign-in page. So this is the link to put on your website if you want to say like access patient portal. So click on settings. And then again here, you can customize everything that people can see in that patient portal. So you can allow self-registration, which I would not suggest, because then anyone, whether they're a patient or non-patient, can go register for your secure messaging portal. So we do invitation only. And then you can, if you want to allow self-registration, say that all clients need to be manually approved. And then if you have a group practice, you should kind of have each person set notify me about my clients only, rather than all the clients I have access to. So for me, because I'm the admin on the account for all of the clinicians, I don't want to be notified for all the clients I have access to. So for me, it's just for my clients. You only are seeing this option because there's one provider on this demo practice queue, but you'll be able to choose which provider you want people assigned to, and there's different options when you have multiple providers. Then the last thing I wanted to review in terms of customization is the forms. So like I said, I have a different form header than Dr. Gallardo or Dr. Bowen. So the way that you would, if you had multiple providers in your practice, as you know, there would be a button down here in the bottom right where you could switch between the providers. So let's say we were on mine and there's 7 other people, you could click on my new client intake questionnaire. You could click on the 3 dots and then click on settings. And then within this, you can click custom header and use a different custom header for this form. So remember, the very first thing we did was go to more settings form header. That form header that we did at the beginning applies to every single form and every single provider. If you want to customize yours, you have to go into your own personal questionnaire and click the custom header, use a different custom header for this form, and then perhaps I would write Brook Choulet instead of practice queue with my own personal email and my own personal social media links, whatever you want it to be. So that is how you would go in and customize per practitioner based on the forms. And again, so this, like I said, isn't my personal practice queue, but I have a separate client intake for adults versus kids. So you would want to make sure that both the adult and the child one have that custom form header for that specific provider. So again, it takes a lot of tedious setup, but once it's set up, it's really customized and really effective for managing multiple people. Any questions so far before I go into the other one-time setup options?
There was one question. They were asking how exactly you got to the website.
Yes, so you go to bookings, booking settings, and then widget, and then you will basically see this. Don't have a website, you can use the link below as your personal booking page. The reason you see it says practiceq.ntq.com/booking is because I've created a vanity URL. So that's really important too in terms of branding. For that, you're going to go to more, and then you are going to go to, I always mix this one up. Oh, I got it right, yes. So more and then account, and then you scroll to the bottom and you click enable vanity URL. So you can make this like whatever you want. Ours is chouletperformance.ntq.com. You want to customize that to your clinic brand. Otherwise, it's going to be something random. So that is another thing to mention, to make sure to customize so that all of your URLs are reflecting your brand. Then while we're in here, this was actually where I wanted to go next. If you're a first-time user and setting this up, you want to make sure you're on the right time zone. It could really mess you up if you are not. You want to put in your organization name, and then you want to make sure to hit save, and then you want to go to clinical, and you want to make sure that your license is typed in. So if you have Arizona medical license, putting in that number, putting in your street address, your state, zip code, everything, because this is going to be on all of your claims and super bills. So that's important to get the clinical piece correct. The BAA is another thing that requires a one-time setup. So you want to put in, this will cover you that you're secure HIPAA covered entity. So you want to put in the name of your organization, your full name, what your role is, check all these boxes and submit signature, and that's it. That makes it HIPAA compliant. So it's a small step to go through, but you need to go through it. The other thing is the notification setup. So going to settings, going to notifications, and then you want to basically check off, if you're me, I want to know all these things. Notify me when a client cancels, replies, attempts to cancel, a client checks in, staff member checks a client in, all of this good stuff. You can also have it send you text messages, so you can put in your phone number to receive text to, and have it text you every time someone checks in. So again, this eliminates, if your sole need is someone to check your patients in at the front, there's a way to do a QR code where you can just have patients scan in, check in, and then it'll shoot you a text and an email that your patients arrived. So even though we have a front desk person on the day she's out or during that 1 hour lunch break, it doesn't interrupt clinic flow at all. So you can also do notification, invoice. So again, this is where you would select notify me when payments rejected, auto charge fails, invoices paid, all that good stuff, and make sure to hit save. The next thing to go through is how to integrate Zoom. So we're already in that more settings tab, and on the left-hand side, you would click integrations and scroll to Zoom, click settings, and you can see that there is a Zoom account connected. I also use this as an extra security precaution, but only show clients initials on the Zoom meeting topic. So for me, it would just show like Zoom meeting with BC instead of the patient's full name. I think that that's just an extra security feature to add on. The next thing is invoice settings. So like we talked about, list invoices, going to those settings, and then really making sure that your logo, your practice info, everything is showing up as you need it, and really customizing these emails, adding taxes if you sell products, and then the super bill. The next thing to look at is, so this one's important if you want to have a website widget to just have people book 10-minute or 15-minute free calls. So let's say you go to your services and you're like, oh, I don't want people to be able to book an in-office appointment or a virtual appointment. I only want them to be able to book this complimentary call on my website widget. It's really easy. All you do is you go into edit and you go to advanced and you highlight hidden service. So like it says here, when you hover over this, check this if you don't want this service to show up in your website widget. This is also where you would go. So we'll go to the virtual one. This is also where you would go to enable Zoom meetings. So we'll click on that. All existing appointments associated with the service will be set to Zoom yes. And that will ensure that you have those automated Zoom emails going out anytime that service is scheduled. Lastly, with the services, I wanted to highlight, so you do this 10-minute complimentary call, you can override that auto charge setting in overrides by automatic charge, don't charge client automatically. So you, of course, don't want patients to even get an email or a bill that the receipt was $0. So I just have don't charge automatically, so there's never an invoice that's created for those. I find that that is very, very helpful. So again, you can choose what services are bookable by highlighting hidden services. So let's say you want your current patients to be able to schedule, you can add in like 30-minute follow-up and leave that as an unhidden service so that the only bookable services are that 10-minute complimentary call and that 30-minute follow-up for returning patients. So there's so much you can do here, and creating basically even like when you have multiple providers, picking who can have access to that service type. And it's very helpful that basically when you put in that price, all the auto charges will go through at that price as long as you've selected the correct service type. So that's really important. We have so many service types: 5-minute call, 10-minute call, 15-minute call, 20-minute call, 25-minute call, 30-minute call, so that we can just select the correct service type and the correct auto charge will go through rather than having to manually enter that and create more administrative burden. I also wanted to go highlight where that processes button is. So under more processes, this is where you can create your processes and automate it to trigger it when a certain event occurs. So just when you get these slides, if you want to copy mine, they're in there. You can put in the same task, the same automation. That is where you would find it, is under more and then processes. And then the last thing I did want to point out briefly too is where that payments tab is to connect your payment system. So this one, like I mentioned, doesn't have the merchant account connected, but this is where you would set up, like you want that auto charge to run 1 hour before, 2 hours before, 1 hour after would all occur here. And then lastly, the settings under booking settings is really helpful because you can actually choose how much lead time do you want when someone books online. Can they book the same day? Do they need to give you a few days heads up? How far in advance can they book their online appointments? Maybe you haven't blocked out your schedule yet. The fake it till you make it, you can actually make yourself look moderately busy or super busy, or just give every single available spot you have. And then the appointment confirmation, you can select if you want to auto confirm, never confirm automatically, or confirm when a card is provided. You can also put in your cancellation policy text here. And then here's a secret hack I didn't know until I emailed NTQ support was I don't want people to be able to reschedule online. I want them to text or call me. So you can actually just put 9999 here so that it doesn't allow online rescheduling. And then at the bottom, you can customize the appointment reminder and actually customize the reminders for individual services. So we actually do go through and customize that reminder text for every single service type. So for a complimentary call, it'll say like your provider will call you at the phone number provided at the time of the call. For this one, it'll say like our cancellation policy and that you'll receive your Zoom link an hour before. And then for this one, it'll say our office address. So you could go in and even further customize per service what you would like it to say. So that is all I had. I wanted to leave some time for questions.
We have quite a few questions.
Okay.
We have one question that asks, can you add more than one license?
Yes. So when you have other providers, so when you click on team and you add other practitioners, you'll like assign them as practitioner and blah, blah, blah. When they log into their practice queue account, they will go to more account clinical, and then they will fill in their own licensure information there. Yes.
Perfect. Do you utilize the portal for child and adolescent patients or the booking widget, or do you use both?
I don't use the booking widget at all. So we don't use the booking widget at all. We want people to fill out our Google form to request a consultation, and then our care coordinator calls them back. Our schedules are each too complex for me to want people to just be able to book something, even if it is a 10-minute call online. And we also like to introduce the practice and all of that. So I don't use the booking widget. The portal I do use for child and adolescent patients, but the parent is the one with access to the portal. So long story short, in our onboarding, parents can select and consent to non-secure electronic communication between me and their child. So for example, when I have a 16-year-old that's driving themselves to the appointment, they can text me and be like, hey, I'm running 5 minutes late, things like that.
Yes. Okay. How do you create a letter to send to a patient?
So in our Google G Suite, we have, each of us have our own letterhead templates, and then we save that as a PDF and upload it into a contact note or into the file section of Practice Queue.
Is there a way to see the patient portal as the patient?
So I think the closest you can get to that is basically to click on that secure messaging, click on settings, and then like basically go through the portal features. And then what you could do is you can basically sign up for your own portal to see what it looks like on the patient end of things and approve your own self-registration. But this is the closest thing where you're basically seeing the style. You basically select what you're allowing the portal features to be, and then customizing that invitation email, selecting how patients register, and then you can click that to see what they're seeing on their end. So actually, while I was waiting for this to get started, I looked at our attendee list and pulled up a few of your Practice Queue messaging login pages, and most of them are not branded and customized, so I highly encourage you to go add in your logo and branding. But this is where you would see what that portal registration looks like if you allow the registration option, and then if you don't and it's invitation only, then it'll just be a login page. So the long answer is you're going to have to create an account and approve yourself to see what the inside of that looks like, but the portal features is going to be the closest.
Okay. So the next question is, I have not played around with the processes yet. Do you guys use the automation section of that? Can you talk about what the differences between those things are?
Yeah, that was the few slides in my PowerPoint where I highlighted the two processes that we use. So that'll be in the recording, and you can pause and take time and look at that and copy that over to yours if it's similar. But we use that for patient onboarding, and we use that for credit card that have been declined to trigger our front desk to send them a new credit card authorization form.
Do you have any good way of incorporating an extern or postdoc into Practice Queue without having to get an extra provider license?
I'm not sure what your specific needs are for whoever asked this question, but if they don't have a license or need anything additional, then I would suggest going to Team and almost creating them an assistant account, because that's free. So it'll allow them to see things and to be able to document, but they're not an actual provider with a license number. So that might be a good workaround.
When it asks which practitioner should new clients be assigned to, it seems to be defaulting to a random clinician, and it doesn't give the option for the assigned clinician to be automatically assigned unless I'm totally missing something. So I think she is asking when it comes to which practitioner the client should be assigned to, how to get it from defaulting.
Are you asking about the portal messaging? So, because in this one, the only reason it's defaulting to one is because there's only one practitioner here. But when you have multiple, you can select, I forget the exact title of the option, but it says something like whichever provider the client's owned by or something like that. So if you're referring to the portal, that's how you navigate that. It's only selecting one because there's only one provider on this one.
Okay. Let's see. Any recommendation on how to set up a past or present med list that carries forward to each note, or I can access in their profile?
This is a more complex question that would require me to build out, or I think I uploaded, let's see, it's not really relevant to scaling practices, so I didn't include it, but essentially in our, I created a test note, let's see here. So you can see in this test note I had done, um, I have a matrix created for medications, and then you can click more and then replicate and copy forward the note. So then in your next note, you can update medications and it still holds the previous ones. Hopefully that answers your question, but feel free to email me or Practice Q support if you have additional questions.
Is there a way to automate an after visit summary to be sent to the patient via the patient portal after their visit?
We don't do after visit summaries because we're concierge practice, so we will send something to them that's kind of curated to them specifically. So I would reach out to Practice Q. I'm sure there is. You can basically you could set up some sort of, perhaps under like booking settings messages, you could do a custom email, so a scheduled email template. You can also, in a patient's account, you can share files. So if you go to this account and you have a file there, you can share files to their portal. So there are different ways to go about it.
Okay, and to that person, we'll also make sure to flag that question so that the Practice Q team can follow back up with you. Let's see, if using time-based billing, is there a way to set up an auto bill based on time spent in the encounter?
So again, because you're doing the auto charge feature, you would have to set up the services with the corresponding charge. So for us, we have like a 30-minute follow-up, a 45-minute follow-up, 60-minute follow-up, and an 80-minute follow-up. So if you wanted to kind of figure out how much time you spent and then have it auto charge, it would be kind of complex because you would really want your payments to run like, let's say 3 to 4 hours after the appointment so that you've selected the correct service type. But then it also risks not getting reimbursed if you have a lot of cards being declined, or if there's no card on file, or whatever might be the case. So I'm a big proponent of having the card auto charge 1 hour before the appointment. In which case you could have the time-based billing, but you would need to know how much time you had spent ahead of the appointment to select the right time duration.
Awesome. Thank you guys for all the questions. We're going to make sure that any questions for Dr. Choulet, that we get those to her and we get your response back, and anything for the Practice Q team that they'll follow back up with you. So we want to say thank you so much, Dr. Choulet. This was absolutely incredible. And to everyone who joined us today, we truly appreciate you being here and spending part of your day with us. We hope you're walking away with some new ideas and inspiration to bring back to your own practice. We look forward to seeing you guys next time. Have a great day.
Thank you.